Good morning and welcome to Issues and Answers, a public affairs program from Cumulus Media in Saginaw. My name is Scott Stein, and today we're going to talk about the McLaren Bay Medical Foundation. We've got a couple guests. We'll introduce them in a second, and we're also going to give you details on a big fundraiser coming up soon for McLaren Bay Medical Foundation called Dinner Around the World. I've attended this event before. It's an awesome event, chance for you to participate and support the McLaren Bay Medical Foundation. Details on the Dinner Around the World event coming up in just a couple minutes. But first, let's say good morning and hello to Jessica Gregory. Jessica is the philanthropy officer for the McLaren Bay Medical Foundation. Good morning, Jessica.
Good morning, Scott.
And also on a phone line here, we have Laura Love. Laura is the community health education specialist with McLaren Bay Medical Foundation. Good morning to you too, Laura.
Good morning.
Thanks for taking some time to join us here and kind of fill us in about the special offerings and what you guys specialize in there at the McLaren Bay Medical Foundation. I guess we'll start with you, Jessica. If you can kind of just in general terms explain what the foundation is all about, its purpose and its mission.
Absolutely, I'd love to. So our mission at the foundation is actually to raise funds that support right here in our hometown McLaren Bay region and McLaren Bay Special Care in improving health care in our community. At the core, we're really about helping to sustain our local hospital and access to health care for our local residents.
And I guess let's get into some detail on what exactly the foundation does and what they can do, you know, when it comes to innovation, education, compassion. Just kind of fill us in on what you guys can do to support the community.
Yeah, so we support kind of the advancement and availability of health care in our community, and you got it right. Those three categories of innovation, education, and compassion are kind of our focus areas. So innovation, an example of that is like that new high-tech equipment that we purchased for the hospital for healthcare in our community. So in the last few years, a 3D mammography machine, mobile digital radiology machines that are mobile, they can move throughout the hospital, a chest compression system. These are just ideas of or examples of equipment that we've purchased that just improve healthcare for our community. Having the very best resources for our staff to provide the best care is absolute key. And then the education, through educational funding, we award grants to our clinical staff at the hospital, help further their education, and we support projects that improve the learning environment at McLaren for our medical students. And then compassionate programs. This is our bread and butter. The Helen Nicholas Clinic offers free health care to uninsured. We've got free health care screenings and education series. These are all supported by and part of the foundation and reach some of our most vulnerable population in the Great Lakes Bay region.
Okay, on that note, let's go ahead and bring Laura into the discussion. We're speaking, first of all, again, if you're just tuning in, Jessica Gregory is philanthropy officer for McLaren Bay Medical Foundation, and Laura Love is community health education specialist. And Laura, you can talk about, the importance of those healthcare screenings, the various screenings that you guys offer there. Very important, aren't they?
They are extremely important, and I am so excited that I get the opportunity to talk to you this morning about these. Health screenings are sometimes things that we think are very basic, like getting our weight done or having our blood pressure taken. We sort of take it for granted. Or we forget that we're actually getting a preventative health screening when we have those things done. But the importance of health screening is trying to identify health problems or conditions early before signs and symptoms occur. Another way to think about it is if we can find problems early on, we can treat them early. And that is so important if we think about cancers or, different kinds of heart disease. If we can find something, a sign or symptom early or a problem, then we have a better rate of treating it.
And let's go through some of those health screenings then. You mentioned cancer, heart disease, those kinds of things. Are we missing a few there?
We are. So we do all types of screenings throughout the year. We do a heart health and stroke screening, which sounds really complicated, but basically we're checking blood pressures, pulses, your cholesterol, your blood sugar, those kinds of things that sometimes we don't always get checked as often as maybe we want to. So it's a free or low-cost way to get it checked. We also do screenings for colorectal cancer. March is Colorectal Cancer Awareness Month, so we have screenings throughout multiple communities. We do a skin cancer screening, a prostate cancer screening, breast cancer. We even do the basics like blood pressure, so all different types of screenings.
How do people find out more about the screenings? Is there a website that they can go to see the list of the screenings, Laura?
Yes, absolutely. If they visit our McLaren.org/Bay Region website, it's just our usual basic McLaren Bay Region website, there's an events section. So you click on that, and that'll bring up all the screenings that we have throughout the year.
Okay, and you mentioned a lot of those screenings, thanks to the McLaren Bay Medical Foundation, are free or a very low cost. And obviously, it takes money to be able to offer these screenings and these programs. And let's bring Jessica back in then, because, people may be wondering, how do you get your funds? How can they support the McLaren Bay Medical Foundation?
Yeah, absolutely. And there are so many opportunities to do that, Scott. Community giving. We do community campaigns throughout the year, so we're reaching out and we're asking our community to contribute funds. And so community giving is a huge part of that. Also, we have been able to be the recipients of planned gifts. We have folks in our community who are leaving their legacy through planned giving and putting us in their wills. So that's always something that someone can consider. Employee giving is really exciting for me because this just shows our employees feel strongly enough about what we do and the investment in healthcare in the community that, we've been around for a little over 40 years. The foundation has here in our local community, and our employees have given back over $2.4 million. So I think that says a lot to our community that our employees are part of this giving and part of the solution. And then special events, and this is my favorite part. This is part of my job, Scott, is the special events. We have 3 really great events that reflect our mission and our hospital. They raise funds, and they contribute to what I consider, and I think Laura's here with me, a thriving Great Lakes Bay region. We love being a part of the region and offering these special events. So those special events, people can attend, people can sponsor the special events, and that's all part of where these funds come from. And Scott, I can talk a little bit about those events now if you want to.
Absolutely. Let's go ahead and start with the one that's coming up here very soon, in just a few weeks, the Dinner Around the World event, which this year here is at the DoubleTree in downtown Bay City. It is.
It's at the DoubleTree on March 16th. Dinner Around the World is an evening event, a Thursday evening event that really, all of our events, they reflect our mission in our hospital, and this celebrates the diversity of the cultures represented in our community, our population, our community, but also among our hospital staff. So we have food tasting stations at Dinner Around the World that represent 10 different countries, raffles. We have some really fun raffles this year, auctions that are silent auctions, maybe some live auctions this year, and it's really just a great time.
And I hear you're going to have a special MC this year.
We are going to have a special MC this year.
Oh, that
our
would
very
be
own
me.
Scott Stein from our media partner, Cumulus Radio. We're so excited to have you, Scott.
Yeah, I've attended this event before, and I'm excited to come back again. And this year to help out with some of the announcements and emceeing. Can you go through, when it comes to Dinner Around the World, literally it's dinner from around the world. Can you give us a little taste, a little flavor of some of the countries, some of the cuisine that'll be featured, maybe even some of the restaurants participating?
Yes, absolutely. We've got the Blooming Chefs restaurant is a brand new restaurant with us this year that I'm excited about, representing France. And if you don't know, Blooming Chefs, these are our student chefs that are over at the Career Center. who have the restaurant right in the Career Center, and so they're doing a beef bourguignon. I hope that I pronounced that correctly.
I think it was perfect.
So basically,
yes.
This is a traditional French beef stew braised in a rich red wine gravy served over whipped potatoes. So excited about that. We have Jamaica, actually, represented by DoubleTree by Hilton, Jamaican jerk chicken. So chicken seasoned with a special blend of island spices over Caribbean beans and rice. The Taste of Bay City, always a classic, a favorite Mexican food, street tacos, shredded pork served in flour tortillas, and then the ceviche tostadas with sriracha sauce. So ceviche tostadas are actually shrimp tostadas with some toppings there. So just an idea, also an idea of what we have, but I also got to tell you, brand new this year, Coven in Bay City, formerly Vino's. Chris over at Coven is becoming very popular for his Bananas Foster, which is a dessert born in New Orleans. The bananas sauteed in butter and cinnamon and bathed in rum, and he sets it aflame.
Wow.
And some of you have probably seen this on Facebook, and you get to see it in person if you attend Dinner Around the World.
Yeah, so not
we're
only
exciting.
dinner,
That's just a sampling.
yeah, not only dinner, but dessert as well, it sounds like.
Yeah, exactly.
And how would people go about getting tickets for that Dinner Around the World event, Jessica?
Yeah, you can give us a call at the office, 895-4727, or jump online. You can order them right online at www.mclaren.org/Bay Foundation DATW.
Okay, and I'm aware of at least a couple more events. The run and walk event that you have and the golf outing. Are those on the agenda for later in the year?
They are actually coming up quickly. May 6th in Uptown Bay City is our 5K walk run. And this is just a really great example of how anyone can practice healthy habits of physical activity. So our participants of this 5K walk and run, they truly do. Some of them walk, some of them run. All age brackets, all fitness levels. It's just about getting out, getting in the community, enjoying what beautiful downtown, Uptown Bay City has to offer. Getting that first kind of breath of our fresh spring air in Michigan here, and getting heart healthy and having fun and fundraising all in one event. So we love 5K. And then our Golf for Life Classic on August 2nd at Maple Leaf Golf Course. So this is a traditional golf outing that actually honors our McLaren healthcare workers. We have a lot of healthcare workers that golf in this outing, 18-hole scramble. We have breakfast, lunch, dinner, players' gifts, gourmet snacks, all the goods. It draws corporate and local business partners, golf enthusiasts, our physicians, board members, and our hospital staff. So lots of opportunities to get involved, Scott.
Yeah, and Cumulus Media,
And
thrilled to
Cumulus
be
Media,
a part of
again, at all three of those events.
Yeah, we're pretty well represented here with the McLaren Bay Medical Foundation. We're speaking with Jessica Gregory. She is Philanthropy Officer, and also Laura Love, Community Health Education Specialist here on the Issues and Answers program. So people know that they can support by, buying tickets for the events and participating in the run and participating in the golf outing. I guess what other ways can people support and get involved with the McLaren Bay Medical Foundation?
Well, I'll say that our foundation also oversees the volunteer program for McLaren Bay Region. So, we're not only managing people's monetary gifts, but we're managing their gifts of time and helping people find any way that they can give and give back and be part of what we're doing here. And so volunteering, if you're interested in volunteering at our local hospital, we have lots of opportunities. Also, we didn't talk a whole ton, but also under our programming is the Helen Nicholas Clinic. So this is a free volunteer clinic that started in actually March of 2004, so we're coming up 19th year. Mm-hmm. Every Wednesday night for the last 19 years, a team of skilled volunteers have been providing free primary medical care to patients that don't have insurance. These are people, members of our community, who slip through the cracks, who don't quite qualify for Medicaid, but they don't quite make enough money. You know, many of them are employed but don't make quite enough money to buy private insurance or aren't offered insurance by their employers. So this is a volunteer. We have a pool of about 70 volunteers. Some of them come every Wednesday night. Some of them come once a month or a couple of times a year. And so if that's of interest to you, if you'd like to give back that way, you know, there's plenty of opportunity there too.
Yeah. Is the Helen M. Nicholas Clinic, is that right at the hospital or is that a different location?
That's at a different location. That's actually here connected in the building that Laura and I are in, over on the corner of Center and Pine and Essexville. It's the McLaren East Medical Mall.
Okay. All right. Well, let's bring Laura back in. Laura is the community health education specialist. And, you know, we talked about the free clinics and the healthcare screenings and whatnot. Really just another chance to, I guess, talk about the importance of making health a priority because, as they always say, without your health, what do you have? Not a whole lot. I know you have some words of encouragement to get people to participating in these clinics.
And I have to say that this is my passion. And so whenever I have the opportunity to talk about this and share making our health a priority is just a great day. So thank you for that opportunity. I often talk about our cars, and I'll get back to the topic here of health being a priority, but we take really good care of our cars. We take care of the engines. We make sure that the oils are checked and okay, I'm not a car person, so I'm not sure what we all do, but we do a lot with our cars. We make sure there's fuel, we fuel it well, but we don't always do that with our bodies. We don't always make sure that the engine, our heart, is doing well. We don't always check the levels, our cholesterol and the different pieces that make up who we are. We don't always take care of ourselves and make ourselves a priority like we do some of the things that are within our realm, like our vehicles. So making our health a priority is extremely important, not only just knowing our body, and if there are changes, being our own health advocate. I think that is so important, or those around you, being an advocate for them as well. But also knowing your own personal and family history, and then what you can do within your own power to make good changes or choices. I know I struggle with these every day, like eating healthy, exercising. The winter, I'm a homebody. But if we can somehow figure out the best way to get physical activity included in our daily life, if we can make healthy food choices, getting to a healthy weight, maybe maintaining a healthy weight, tobacco, that's one of those big ones. If we are using any kind of tobacco products, to stop. It affects so many different systems in our health, in our body. So if we can stop smoking or vaping or chewing tobacco, any of those different ways, we will make really, really good impact on our health long term. Other things like protecting our skin in the summer from the sun, using good sunscreen, those kinds of things. Just basic things that we probably know, but sometimes forget because we're busy taking care of other people.
Yeah, I mean, every single day it should be a priority, your health. And it is a challenge. It's hard sometimes when you're busy. And I like what you said, not only watch for yourself, but advocate for others too, who may be in a situation where they don't have anybody to turn to. You can strongly suggest that they turn to the McLaren Bay Medical Foundation for some of those clinics and healthcare screenings. Thank you, ladies, very much for your time this morning. I think, did we miss anything major, or are we looking good here?
I think we got a lot of information. We've shared a lot of information. I just wanted to add, Laura talked about all the things you can do, and we've got, I know that one of our volunteers at the hospital I just recently talked to, and she's been attending Laura's screening programs for the last 5 years, since 2018, and she said that she still goes to her family doctor because that's really important. This doesn't replicate that. Mm-hmm. Or this doesn't replace that, I'm sorry. She still goes to her family doctor, but in between, she keeps up on her numbers and keeps a check on her general health, and she is so grateful that Laura and the program is here and available to do that. and talking about all those health things, I also just wanted to say that there is a growing body of research that shows that donating and volunteering and doing all those things in the community actually has a positive impact on your physical and mental health as well, and can contribute to a longer life. So benefits include lower blood pressure, lower risk of dementia, less anxiety and depression, reduced cardiovascular risk. And so all around, we feel like we're doing really great things in our region and making a positive impact and giving people opportunities to do that for themselves.
Okay, and one more time, can you give us the website, ladies?
For screenings or education programs, if you check out mclaren.org/Bay Region, and then you click on events, or I do have a toll-free number that sometimes is easier for people, and that's 1-877-411-2762. And all of the health screenings that we talked about today are available for appointments, so you can call and get more information too that way.
All right. Well, thank you for all you guys do for the community and keeping everyone healthy. McLaren Bay Medical Foundation, Jessica and Laura, thank you so much for your time, and I'll see you at the Dinner Around the World event. Again, that's Thursday, March 16th, which is St. Patrick's Day Eve. So it'll be a good kind of prelude to your St. Patrick's Day celebrations. If you
there might be a little Irish music.
Absolutely. Sounds good. And I will see you guys there. And thanks for your time this morning.
Thank you.
Thank you so much.
You are most welcome. That's going to wrap up this edition of Issues and Answers, a public affairs program from Cumulus Media in Saginaw. Scott Stein saying, have a great Sunday.